Go, go, go. That's the birthday. That's the birthday.
Yo, Z-Pack! This episode is made possible by the generous sponsorship of Athena Health. Athena Health partners with hospital and ambulatory clients to drive results. They offer network-enabled medical record, revenue cycle management, patient engagement, care coordination, and population health services to build Health 3.0. Yo, get back to the work you love doing. Athena Health. Free up. Ground control to the Z-Pack. You've really going to melt your brain, 'cause I've got the most amazing guest today. And he's the Chief Health and Medical Officer for NASA. This is Ground Control to Dr. Polk.
Dr. Z, thanks for having me. Hey, thanks for sporting the NASA colors, too.
We represent
astronaut-like with that helmet too. I'm pretty impressed. We do have a selection coming up in about 3 years. If you're up,
you have to understand. So, guys, Z-Pack, Dr. Polk is the Chief Health and Medical Officer for NASA. He watches the show, saw me wearing the shirt, and was like, "Hey, really? Thanks for the shirt." And I'm like, "Oh my God, NASA just emailed me," and I nearly burst into tears because since I was a kid, I've always wanted to be an astronaut. I did some astrophysics stuff in college, but I wasn't smart enough in the math and certainly wasn't ripped enough to be an astronaut. And so when I realized that Doctor, who's the head of the sort of medical stuff for NASA, was in connection with me, I was like, oh, please be on the show because we have so many questions for you.
Oh, I'm happy to be here. And hey, before we get started, though, I just want to thank you and the Z-Pack for your support of UMC and Sunrise and all the pre-hospital providers following that tragedy over the weekend, and your support, I'm sure, is very appreciated by your colleagues, and certainly our hearts go out to all the victims and their families, and all the brothers and sisters in our healthcare profession out there in Las Vegas.
Yeah, that means so much because in healthcare we're all one tribe. Whether we're in space or on Earth, or trying to help people in the ways that we can. So I really deeply appreciate that. So, Dr. Polk, I first have to see, where are you? Because you look like you're in an undisclosed bunker location.
This is a kind of a cool place. This is the Space Operations Center at headquarters, and this is kind of like a little miniature mission control, for lack of a better word, where we will monitor spacewalks here from headquarters here. But I'll give you a little 360 tour here. We've got, of course, you've got the beautiful logo over here, and we've got on this big screen over here where you see the. Let me see if I can get it there. The NASA meatball back there in the center. That's probably where we would watch the spacewalks, and then the astronauts' helmet cams would be projected on these screens over here as well, so we can see what nuts and bolts they're actually working on and see what functions they're working on. And that's over here, at least. Let me give you a little walking tour here. There's the model for the International Space Station here, so that we can figure out where they're at on the truss as they're doing the spacewalk. And of course, that's the crew that's currently on orbit. And they're working hard right now and actually getting ready for a spacewalk coming up.
I can't believe that I'm seeing this. Like, you don't understand what a fan of NASA I am. Since I was a kid, and in 1980 I saw the first space shuttle launch. To see this, I mean, I was what, like 7 or something, and I remember crying, thinking it was such an amazing thing.
Oh, it vibrates through the whole cells of your body. I never got tired of going to the space shuttle launches. And of course, our new rocket, the SLS and Orion, will be taken off before too long, in the next couple of years, and it is bigger and more powerful than the Saturn V, and so it's going to be a phenomenal spectacle.
That is so exciting. But let me back up for a second. You're a doctor. You trained in osteopathic medicine. Your specialty is
emergency medicine and aerospace.
Wow.
I'm dual boarded, so. Which is typical of most of our flight surgeons at NASA. They're usually either primary care-based, family practice, emergency medicine, internal medicine, neurology, several other specialties, and also aerospace.
Wow. And so after training, you were a dean at a medical school for a while?
Yep, out in Des Moines University. I took a kind of a detour on occasion to do education, and also did a stint with Homeland Security, but then came back home to NASA.
Wow.
And it's I tell you what, it's a phenomenal mission here, and yeah, it's funny when I talk to my ER colleagues, because they'll be telling me what they did for the day with this overdose or this thing that came in, and well, what'd you do today? Well, I worked on the Mars mission. And I worked on this, and it sounds funny coming out of your mouth, and but it's what we do.
You know, JD, I got to say this though, because you know how emergency docs are. You're one of them. They always try to out-extreme each other. So it's like, oh, bro, I was just para-snorkeling in Machu Picchu in my spandex, and I did one-arm chest compressions on a nun who'd fallen there. And then you come up and you're like, yeah, I just worked on the Mars mission and stuff, so, you know, whatever.
It just kind of shut things down a little bit. It's, sometimes I don't get a call back. I don't know why.
They're very competitive. So you got into space medicine. Emergency medicine seems like a good fit for that. Mm-hmm. Did you have to do extra training, or was it part of stuff you already knew? How did you become the space doc?
Well, it's a lot of extra training when we get to NASA, and we got to bring folks up to speed. I mean, something that we take for granted. Think about like a scratched cornea. Yeah. In the ER, you do a little toe break, you put the drops in. The only problem is in space, eye drops don't drop. Oh. So, how do you do that? How do you make a small ball of the medicine and then using surface tension have the astronauts actually put their eye into it? And so even something really simple like eye drops is different in space.
And what would happen? I'm going to put my helmet on because I need to really put my thinking cap on here. What would happen if somebody got an appy in space or an emergency? Yeah.
Well, for right now, the International Space Station, of course, about somewhere between 240 and 260 nautical miles above the Earth. It varies a little bit depending on our reboost, but
over the flat Earth, right? The Earth is flat. I just want to make sure.
I think that one was settled about 2,500 years ago. But if they had an appy right now, we'd bring them home, obviously. And there are hospitals that we go and visit and evaluate in Kazakhstan, because right now we'd be landing with a Russian Soyuz, and we get them into a hospital in Kazakhstan right away.
So let me just understand this correctly. Dr. Borat is treating our astronauts if they land with an appy. In Kazakhstan,
maybe
appy.
But we work really well with our colleagues in Kazakhstan, and I've visited their hospitals multiple times. And I tell you what, they are some stellar folks as well.
That's amazing. That's amazing.
But of course, it'll change for Mars. I mean, when you get to Mars, you can't just come home when something happens, and so. We got to train folks, figure out, and it's an interesting question with the appy example, because we've had folks ask, would you take the appy out ahead of time before somebody goes to Mars? And there's a lot of ethical dilemmas that come with that, taking out a normal organ out of somebody that's asymptomatic just to prevent what maybe kind of sort of might happen.
Wow.
Or do we treat it surgically and train them to do the surgery? Or, as you know, in multiple countries, they treat appies medically with antibiotics and have about a 73% success rate. So we kind of have to balance all of those things on what we're going to do.
And here's a related question. So what about, and this was a question Tom wanted to ask, and I was like, oh, it's not a good question. And then I realized, no, it actually is a good question. Sexual intercourse in space, potential reproductive issues. If you're on the way to Mars and someone gets pregnant, what do you do?
Well, good question. I mean, as you know, the biggest risk is an ectopic pregnancy, and you worry about those things being a medical emergency. But for the most part, I'll tell you, a lot of the female astronauts will use hormonal therapy just to prevent the periods in space.
Right.
Just because we've got a urine reclamation system, which doesn't do really well with blood and some of these other things that we have. And it's an inconvenience as well. And so for the most part, there's an automatic birth control that comes with those hormonal therapies trying to prevent periods in space as well. But, could things happen? Sure, things could happen, and we would deal with that as it occurred. But, we do research right now looking at how different things evolve in space and what is required for growth with microgravity and what is gravity dependent and what's not.
So could a fetus, in theory, actually develop properly in a zero-gravity environment? Has it ever been studied?
Good question. Not a human fetus for sure. We have not studied that yet. But have we looked at tadpoles and other things in space? Yes, to see how they evolve. And, it seems that life pretty much adapts to just about anything. It's amazing how life everywhere seems to adapt. Even our astronauts adapt to microgravity on the International Space Station. They've got bone loss that occurs. They've got some intracranial pressure in about 25% of the astronauts because of the fluid shift upwards. So there's some physiologic changes, but we've learned that we can survive in space for up to a year and adapt.
That's amazing. Well, here's a question I was wondering as a hospitalist. We're always worried about DVT prophylaxis and this kind of thing. Are DVTs, deep venous thrombosis, a problem in space? Yeah.
Actually not, and it's there are a couple things that actually improve in space. One is because of all the fluid that you think about in your lower extremities moves upward into the thorax and head. We really don't have much in the way of venous stasis in the lower extremities. So if you are prone to DVTs, space is your game. This is a great place to go. The other thing that actually improves in space is lung diffusion. If you think about it on Earth, we always talk about this VQ mismatch.
Yeah.
And the apices don't get a lot of blood, but they get a lot of air. But in space, the entire lung, because of all that blood moving upwards into the head and thorax, the entire lung is saturated with blood. And so you don't really have a VQ mismatch in space.
Wow.
So it's kind of neat. It's kind of like, Guyton on steroids from a physiologic standpoint. It's really neat to study it and see all the changes.
Well, Dr. Polk, you've given me great dispo plans for my hypercoagulable patients. Next time I'll just write an order, dispo to space, like PRN, clot.
Right, little Eliquis, little space, it'll all be fine.
Incredible. Do you have astronauts who are on medications chronically, or is that one of the sort of contraindications to going into space?
Well, no, we do a really rigorous preventive medicine program for the astronauts, and we lower their risk, probably lower than the general population would be lowered. We are pretty aggressive on cholesterol and their blood pressure, et cetera. But I got to tell you, they're a pretty healthy cohort to start with. We cheat in the beginning because we start with good protoplasm, and they have to meet the medical requirements just to get in. They exercise a great deal. These are folks that are in the gym and running, et cetera, and they're competitive athletes and Navy SEALs and et cetera. So we start with really good protoplasm. There are some that will be on medications like a statin or something else to reduce their risk, but that's mostly to reduce the overall risk to make sure that they don't start to accrue plaque, because many of them will be in training for almost 10 years before they fly. It could be 3, 5, or 10 years before they do a mission, and so we've got to keep them as healthy as possible and get their risk factors as low as possible before they fly.
That actually makes a lot of sense, because you don't want to invest in someone who's just going to have a massive MI by the time their training is done. And I imagine the training is stressful and rather inflammatory in terms of...
Absolutely. Actually, till they die. We see the astronauts till they die. They come back and do an annual physical with us, even after they leave NASA, because we look to see, did radiation or did space or other things have a long-term effect. And so we do a surveillance program on them as well.
And that was a question I wanted to ask, because I know they looked at moon astronauts and they're seeing a little higher prevalence of atherosclerotic disease. And the question is, was the radiation exposure on route to the moon causing intimal damage and that sort of thing? What are your thoughts on that?
Yeah, on that study, about 3 months later, the press picked up that study and had it highlighted. But about 3 months later, the second study showed that actually the analysis that they did from an epidemiologic standpoint was flawed.
Oh. Actually,
the astronauts were actually a little less prone to particular disease than the general population. And the reason for that is again, because of, we are really aggressive with the preventive medicine program. And, astronauts are not out there chain smoking, and, they're a healthy cohort. So unfortunately, it's like most things, it depends on how you ran the statistics and the epidemiology. Could there be a risk to radiation to the intimal lining from inflammation, et cetera? Yes, and those are things that we look at, and we work with the NRC and other radiation councils, and a lot of experts in the field to look and see what our risk will be. But radiation is probably our long pole in the tent for Mars. Yeah, it is, right? Because you're going to be out there, and just even flying in airplanes increases very slightly your exposure.
And so this is fascinating because I guess one of the questions I would have is when you're preparing for Mars, you're thinking about things that we don't normally think about. For example, the radiation piece, the API piece. What about decompression issues? So if there is a breach, how can you survive transiently in the vacuum of space? And are there ways to do that?
Well, that is a big risk for us. We have what's called an MMOD risk, which is micrometeoroid orbital debris risk. And so you got to remember that a little chunk of sand or a little chunk of rock is moving at 17,500 miles an hour on orbit right now. And so that could do some pretty heavy damage to a spacecraft and cause a decompression. First, we do what's called feed the leak, which is we've got different gases and pressurized vessels in the spacecraft and try to feed that leak. Obviously, the astronauts try to seal it after that. They have masks with 100% pressurized oxygen that they can use. And if all else fails, we can always get one of two things: either into a spacesuit and pressurize it, or get into the Soyuz and close the hatch and pressurize it. Right. So those are things that we practice, and we do simulations and mission control. There's some really, tell you what, those are some rigorous days when they throw you a whole bunch of simulations at mission control, and it's something where 4 or 5 or 6 things go wrong, and they put you through the mill.
I'm just putting my suit on just in case it gets real in here. To me, by the way, I have to say this. To me, you have probably the greatest job in all of medicine because, again...
Could you tell my wife?
I will. The wives never understand our obsession with space. Unless they share it. And the idea that, when you're a kid, you want to go into space, and the fact that you can be the doctor. So as your role of Chief Health and Medical Officer for all of NASA, do you also oversee research? Do you also do other things like that? Or is it just focusing on astronauts who are in space or going into space?
We actually have several roles. There's one as the Chief Medical Officer where we're overseeing the medical care of astronauts and the employees and the health aspect of the agency. There's another hat that we wear called the Health and Medical Technical Authority. And what that is the technical expert for all things medical for the spacecraft. So how much oxygen is it going to have? What's the atmosphere going to be like? What's the seat angle? All of those things for all these vehicles that we're building. And this is really, quite frankly, the busiest time at NASA in our history. Most people think of the Apollo era, but we're working with SpaceX and Boeing, and we're working on what's called Deep Space Gateway and Deep Space Transport, the Orion, the SLS, multiple X-planes, the ISS. I mean, those are like 7 or 8 programs in development right now that we weigh in on from a technical expertise on the human systems requirements. And that's one of our biggest roles.
That's amazing. So you guys are busier than ever, and of course underfunded, and of course all the other things. And one of our roles on the show is to raise awareness within the healthcare tribe of what you guys are doing and how you're a part of our tribe deeply. Everything we learn in NASA, everything we learn at the engineering levels comes back to us and helps us here on Earth. So people are like, well, what about our uninsured homeless guy here? Why are we funding NASA? My feeling is exactly why we're funding NASA, because we're going to find innovative ways to actually bend the entire curve of how we care for people on Earth.
Good example. I mean, right now there's a salmonella outbreak in the United States with a lot of people going to the ER. One of the research that we've done, one of the small pieces of research that we've done out of the thousands on the International Space Station is actually on the salmonella vaccine. Because in microgravity, proteins and crystals form differently. And so they've actually discovered several different strategic targets on the bacterium that allow us to invent new vaccines. And so we're getting pretty close on that one for salmonella. Same with MRSA. And you think about how much money the U.S. economy and hospitals spend on MRSA. And the ISS has been a unique laboratory to allow some novel vaccine research. We're doing Parkinson's research right now on the space station. There's a lot of things that will come down onto the ground that most people have no idea actually had its birth or its insight from NASA.
Dr. Polk, I'm sorry, speaking of radiation and protection, after talking about vaccines and those sort of things, I need to make sure I'm safe because I'm very afraid that the toxins that are coming down from the International Space Station with your vaccine research, which, by the way, it is entirely possible to become autistic in space acutely from vaccination, might affect me. How, and this segues me into this next thing, so that's a very nice way to understand how your work can actually help us here on the ground. How do you deal with the kind of conspiracy types who are constantly, whether it's anti-vaccine types, anti-NASA types, people who think the Earth is flat, do you have to deal with that at all, or is that just, you leave that for like normal, rational people to just go, you're dumb?
You know, we get a lot of those questions and feedback a lot, but what we're really interested in is the evidence and the data that we continue to accrue. And that's probably the unique part about this job is when we go around the room, when we're doing a senior staff meeting, the amount of work and the amount of discoveries. I mean, how many people when they're at work on a Monday talk about, hey, we discovered 10 new planets in a solar system and half of those might be habitable. And so, I mean, we just, you know, we're at a, for lack of a better word, a senior varsity conversation. And so we don't worry too much about some of the other junior varsity conversations.
That's probably the best response I've ever heard to that question. And I have to say this, because this actually reminds me. So, okay, you guys already know there are aliens and just aren't telling us. How are you, and this is a serious question, how are you going to break the news to a rapt Earth population when you do discover extraterrestrial life? Because we know as statisticians it exists. And the question is, have you guys thought about this internally? Like, how do you do this without creating mass hysteria, religious cataclysms, you know, all the other stuff?
Well, I will just say that'll be at a pay grade well above mine. And it won't be J.D. Polk who will be announcing that to the world in any form or fashion. So, but, you know, it is a good point that you bring about that there's so many different planets as we continue to discover with all of our telescopes, multiple different planets and multiple that are rocky planets and in what we call habitable zones. It's an interesting premise that would be very interesting to see. But yeah, we for right now, we're just happy to keep exploring and keep discovering.
You know, and I'm completely convinced that Logan is in fact an alien that you guys sent to me just for testing purposes. But
lies!
No lies, Logan, no lies. Truth. I'm just speaking truth to NASA here. Let me ask you a question before I miss this opportunity, because I think it's important to a lot of healthcare people. You guys did one of the world's most amazing placebo-controlled trials on an astronaut and his twin brother.
Absolutely.
Scott Kelly, could you tell me a little bit about this? Because this to me is one of the best ways to actually study an issue. It's a twin study and you separate them by thousands of miles and lots of atmospheric pressure.
Well, that was a great study. First of all, it's hard to keep that one, you know, as you know, we try to, you know, keep a patient's masked or confidentiality, but hard to do that when you're flying a twin and everyone knows that you're comparing him to his twin. But, you know, we got some disclosure statements and things signed from Scott ahead of time. And I tell you what, Scott was a great astronaut to work with because he was so enthusiastic about the research and what this could show. And there were some really unique discoveries there. I mean, we expected that due to the radiation that the telomeres would get shorter and Scott's were longer. And there were a lot of things on the epigenetics and the genetic standpoint and chromosome standpoint that quite frankly, we had some very novel discoveries. And the folks at the universities, multiple different universities that were involved in the research were just elated with some of the things that we got back.
Wow.
And you know, with CRISPR technologies and things coming up now, and then you get some new knowledge coming from space as to how the chromosomes actually work and what would happen for them. It really opened up some eyes in some of those different areas, and we're still learning things and still going through the data from Scott's research, and it's pretty phenomenal.
Guys, so Z-Pack, if you think that there isn't a good reason to support NASA and NASA funding, what Dr. Polk just said is top paramount, especially in this era of cutting research dollars. If we're going to actually improve precision medicine and actually make Health 3.0 a reality by focusing on unique patients using technology and the interpersonal piece, then NASA is a big part of that. And that's why I was so excited when we connected.
Always a pleasure.
It's really
always a pleasure to be here. And I love those NASA colors, man. Yeah.
Represent.
Support the NASA colors.
I wear this proudly and also enviously of doctors and astronauts and folks like you who are really doing amazing work for all of humanity, not just for the U.S., for all of us together. And by the way, if an asteroid comes, I expect to be the first to know, so let me know because I have my underground bunker figured out already.
Roger that. Well, I'll make sure I send at least an email, a courtesy email, if that occurs.
I love it. I love it. And the last thing I just wanted to end with was you. So you also have a business degree in medical management from USC.
I do, which I understand is kind of a rival to your alma mater, but that's probably why I got stuck in management. Is I'm one of the few physicians that also knows space medicine but can do a budget.
So you are the perfect storm of evil administrator, extreme emergency medicine doc, and just wide-eyed boy enthusiast for space, and it all comes together.
Exactly. And my wife allows me to do all of them, and for the last 15 years. Well,
the next time you're in Vegas, your wife and my wife can hang out because I'm sure they've got a lot to commiserate over.
Absolutely.
I really want to respect your time. We're at the half an hour mark. It's been such a thrill to connect with you, and the Z-Pack has just been blowing up. Hey, Tom, is there any comment that we want to leave with or anything?
One that's pretty interesting is Jennifer Fox wanted to know how many doctors, nurses, and other healthcare workers does Dr. Polk have under him at NASA?
So one of the questions was Jennifer Fox asked, how many doctors, healthcare workers do you have under you at NASA?
Well, we have a whole host of folks, but for the flight surgeons, there's about 18 flight surgeons total. But we also have physicians at each NASA center, Cleveland, Langley, in Virginia, Florida, that take care of the employees as well. So occupational medicine physicians, in addition to the flight surgeons that are manning mission control and working space missions. But we have nursing staff in our own clinic, and we also have biomedical engineers, and a whole host of those folks who might specialize in something like spacesuits or might specialize in something like exercise equipment. Wow. And then all the research folks that you mentioned as well that are doing the human research, doing a phenomenal job of that in several different centers. And so it's hard to know the exact number, but there's more people than I can count that are somehow touch it in one way or another with either the research, biomedical engineering, and medicine. But it's amazing how they all come together, and it all coalesces into a mission. It's great to see when it does.
3.0 in effect. Tom, other comments?
Yeah, can you ask Dr. Polk what the aliens want to do with our buttholes and why they're so interested in it?
That's true.
I don't know if you caught that, Dr. Polk, but I'm going to translate it into non-offensive for you. Tom Heineber asks if you have a sense of what the aliens want to do with our posterior stoma or anus when they do probe us.
I would imagine they would do a colonoscopy and then bill under ICD-10.
Those aliens gots to get paid, JD. They gots to get paid.
They do.
Because
I figure if they're a higher intelligent being, they'll probably get a better ICD-10 code than what we would come up with.
And my dad has always said there's 5,000 rupees in the colon. You just have to go with a scope and take it out. And aliens probably got that transmission early on.
They probably did.
Again, we're so delighted to have you on the show. We're deeply honored. Thank you for your service to everybody, all of humanity. And again, we're super jealous of you.
Well, thanks so much. And again, thanks for all you're doing for the folks in Las Vegas and for our colleagues at UMC. And thanks also for sporting the NASA colors. And we're happy to be here and get out to the Z-Pack.
Yes. Z-Pack, do you hear that? NASA is on our side. We can do everything together. And I want to thank JD Polk, the Chief Health and Medical Officer for NASA. And we are out.
Go, 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 go. That's the birthday.
I think you and I are next week. You're at National Harbor next week.
This episode is made possible by the generous sponsorship of Athena Health. Athena Health partners with hospital and ambulatory clients to drive results. They offer network-enabled medical record, revenue cycle management, patient engagement, care coordination, and population health services to build Health 3.0. Yo, get back to the work you love doing. Athena Health. Free up.